traumatic experience is any event that causes extreme distress or terror and overwhelms a person's ability to cope. It can be a single event or multiple events, but it is always beyond a person's control. Traumatic events are also characterized by a sense of danger or threat to one's life or someone else's.
Trauma is a normal response to an abnormal event, but what is a positive protective mechanism during the trauma can later affect a person's life in negative ways. Trauma not only affects a person emotionally, but also biologically. The amygdala affects the body's stress response and the fight, flight, or freeze response. The hippocampus controls memory and affects the amygdala by responding to stressful stimuli in a similar way. Repetitive experiences create neural pathways that will affect how a person naturally responds to stressors. The brain can become hyper-aroused, where the brain is more sensitive and may react to smaller stressors. On the other hand, the brain can also become sensitized, where it takes more stress for the brain to react.
Certain behaviors in children may indicate that a traumatic experience has occurred. It sometimes may seem that a student is acting out for no reason, but often there are factors affecting an individual's behavior that they themselves may not even be aware of. Behaviors such as aggression, isolation, self-harm, drug use, and difficulty concentrating may be rooted in deeper issues. Be mindful that trauma can affect behavior. Trauma that occurs within each life stage can create specific unmet needs. When an individual suffers trauma, it has an effect on their development during that period. For example, from birth to age 3, we learn to mirror and express emotions, and experiencing trauma during this period may cause children to delay or halt this development, causing them to exhibit regressive behaviors. Therefore, it is important to remember that a student's chronological age may not accurately represent their developmental growth.
From trauma is all about human relationships. Even with the best medications and therapy, healing and recovery is impossible without lasting, caring connections to others. It rebuilds trust, confidence, and security. Because many children impacted by trauma have experienced the breaking down of relationships, they may feel isolation, shame, fear of authority, or aggression. One of the ways that schools can restore this sense of connection is by encouraging kids to engage in healthy physical touch, games, recess time, and any activity that encourages social skills or teamwork.
Structure and routine foster resilience because they create predictability and stability. Fear and uncertainty are core factors in the life of a traumatized person. In order to reduce this, it is helpful to create an organized routine for students so they feel a sense of control over their day. Additionally, responding to students in a consistent and patient manner allows for a sense of security. Individuals should have choices and control over their healing process. Pushing someone to tell their story, process their emotions, or forgive a perpetrator can do more harm than good. To allow for genuine growth, survivors of trauma must have space to process at their own pace and choose what healing looks like for them. Giving students a safe space is invaluable, but it is their choice to choose whether or not to utilize it.
In the same ways that neural pathways can be built as a result of trauma or negative experiences, new neural pathways can be created by repetitive positive experiences. While trauma greatly affects the biology of the brain also shows biological examples of resiliency. As educators, it is important to be able to identify different brain states and how to help a child experiencing that. When a child is experiencing terror or rage, they are in the survival brain state, and a teacher must help the child to feel safe. The best way to soothe a child that is experiencing alarm or agitation is through connection. And the last brain state is the executive state, which is optimal for learning and problem solving. This is the ideal brain state for children trying to learn in a classroom.
Working with trauma-impacted individuals can take a serious toll on those who are helpers. It is important for educators who work with children exposed to trauma to be willing to enter into the world of students, but also able to regulate their own emotions to avoid burnout. Engaging in regular, intentional self-care practices can help educators to provide the best quality of teaching.
Signs of experiencing compassion fatigue, secondary trauma, or burnout include a loss of compassion for others, dwelling on the problems of your clients, having nightmares, or experiencing depression or hopelessness, along with many others. Self-care is an important aspect of protection and an outlet to healthy processing and integration. Some of these may include leisure activities such as dancing, journaling, or investing in healthy relationships.
Collaboration and mentorship are a necessary part of support within the social work field. Working alone can be exhausting. Leaning on teammates and relying on others for support is a healthy way of caring for yourself even amidst your workday. You cannot take care of others without first taking care of yourself. Self-care is not an egocentric act. It is the ability to choose to invest deeply in relationships by choosing to invest in yourself. By taking time to step back, the people in your life get the best of you, not what's left of you.